بسم الله الرحمن الرحيم. Infant Feeding by Professor د.سمير الحسن, Professor of Pediatrics, Mansoura University. Good nutrition is very important during infancy due to rapid growth and development, especially in the first year of life. In early infancy, all the capabilities for feeding are suckling and swallowing reflexes, which necessitates a liquid nutrient. What's such a liquid nutrient? It is milk, the natural, unique liquid which provides infant with daily requirements of energy, water, micronutrients, and macronutrients. All female mammals feed their offspring with milk secreted by their mammary glands. However, the constituents of such milk is variable according to the growth and development pattern of each mammalian species. Thus, human milk is the best nutrient for infant feeding, and breastfeeding is a global priority. Different studies show that infants who are exclusively breastfed for the first 6 months grow well and are healthy. And also mother's milk is especially suited for her own baby. And all breast milk is not alike. Colostrum and mature milk are adapted to gestational age and to postnatal age, and also there is a seasonal variation in the composition of the milk, even from month to month, day to day, and feed to feed, even in the same feed, to meet each particular need. This figure illustrates the differences of concentrations of macronutrients in some mammals. As shown in the figure, there are complete differences between human breast milk and other mammalian milk. These indicate that, number one, mammalian milk is species specific according to the pattern of growth and development of each species. Number two, animal milk is not suitable for infant feeding without adaptation. This figure shows the dynamic nature of human milk. In the first few days after delivery, the milk produced is known as colostrum. Colostrum is scanty in amount, few milliliters or even few drops. Colostrum has high specific gravity, is lemon yellow in color, has high protein, low fat and low carbohydrate content. Colostrum has three functions. Number one, immune function, provides the infant with humoral and cellular immunity, especially secretory immunoglobulin A. And number two, a nutritional function, is highly nutrient. Number three, laxative function, it facilitates the early passage of meconium. Colostrum is followed by the transitional milk, which has higher content of protein and showed an increase in carbohydrate and fat. And lastly, mature milk is formed in the second week after delivery. It contains protein in a concentration of 1 to 1.5 gram per dl and fat 3 to 3.5 grams per dl and carbohydrate 7 grams per dl. The carbohydrate or the lactose of human breast milk is high in carbohydrate when compared with other mammalian milks, and this gives him the sweet taste. If you look to the percentage of macronutrients in the mature milk, it's apparent that the human milk is a more or less balanced nutrient as regards the caloric sources. Each 100 milliliter of human milk contains about 67 calories. Breast is the organ responsible for milk synthesis. Breast is a modified sebaceous gland. From a structural point of view, breast is formed of glandular tissues and supporting tissues. The glandular tissues include milk acini for milk secretion and the duct system or lactiferous duct for milk drain. Milk acini are epithelial cells which are surrounded by a layer of smooth muscle fibers known as myoepithelium, as shown in the lower figure. Contraction of such myoepithelium eject milk into the duct system to be drained and stored in milk sinuses located beneath the areola. Areola is the dark circular zone surrounding the nipple. The supporting tissues are formed of skin, fat cells, connective tissue fibers, and muscles of the anterior chest wall. The amount of milk production by the breast depends upon the mass of the glandular tissue, but not upon the whole size of the breast. Mechanism of milk production and milk release. Milk production and milk release, as shown in this figure, is under a control of a reflex mechanism known as suckling reflex. How it works? Suckling of the breast sends nerve impulses which stimulate secretion of prolactin from the anterior pituitary gland and oxytocin hormone from the posterior pituitary gland. Prolactin hormone stimulates milk acini to secrete milk, and oxytocin hormone stimulates myoepithelium to eject formed milk. Factors affecting milk production. There are multiple factors affecting milk production. Number one, suckling mechanism. Suckling mechanism is the most important mechanical factor for increasing milk production by inducing the let-down reflex. Thus, to increase milk production, a lactating mother should practice frequent suckling. Number two, nutritional status of the mother. Good nutrition and sufficient amount of fluids and water is an important factor for milk supply. Number three, mood of the mother. A mother in a good mood produces more milk than an anxious or sad or a mother under daily home troubles. Number four, other hormones including thyroxine, steroid hormones, and insulin affect milk supply. So, problems affecting such hormones should be managed. Number five, galactagogues. Galactagogues are medicines or herbs like fenugreek oil, which may increase breast milk production in some lactating mothers. Thus, these factors should be considered to increase breast milk supply before advising artificial feeding in any mother with poor milk supply. Advantages and benefits of breastfeeding. Breastfeeding has multiple benefits to the infant and his lactating mother. But we are going to discuss only some of the important benefits under the following headings. Number 1, general benefits. Number 2, benefits to the infant. And number 3, benefits to the mother. General benefits of breastfeeding. Breastfeeding has the following general benefits. Number 1, milk is always sterile, no pathogens. Number 2, it is available at any time, day and night. Number 3, from the economic point of view, it has no financial burden on the family income or even on the society as a whole. The most two fundamental benefits of breastfeeding to the infant are number 1, protection of the infant against infection in a critical age of high susceptibility to infection due to low immunity. Number 2, superior nutritional composition essential for physical growth, intellectual and emotional development. Then, how does human milk protect infant against infection? Breast milk contains humoral and cellular immunity, including immunoglobulins, T and B lymphocytes, macrophages, complement, and other important components. Number 2, breast milk contains lactoferrin, an iron-chelating protein, which deprives microorganisms from iron, so inhibits its flourishment. Number 3, breast milk contains probiotics, which are beneficial microorganisms. Its flourishment inhibits the colonization of the gut with harmful pathogenic microorganisms. Number 4, breast milk is rich in prebiotic, which are oligosaccharides, important for promotion of growth of probiotics. Lastly, breastfeeding. Nutritional benefits of breastfeeding. Breast milk has numerous nutritional benefits, but I will discuss the benefits of some major constituents of breast milk. As regards macronutrients, breast milk protein is about 1 to 1.5 gram per dl. It is rich in wheat, low in casein, so it forms fine-cured, easily digestible, no gastrointestinal upset. Breast milk fat is about 3 to 3.5 gram per dl. It is rich in unsaturated fatty acids, rich in long-chain polyunsaturated fatty acids, abbreviated as PUFA, which is essential for cognitive and visual development. It contains lipase enzyme for fat digestion, and it is low in saturated fatty acids and volatile fatty acids, so there is no flatulence. Breast milk carbohydrate is lactose. It is about 7 gram per dl. So it is rich in lactose, which gives sweet taste, and it is the main source of energy. As regards the minerals and micronutrients of breast milk, the total minerals of breast milk is low, so no overload over the immature kidney of the infant. The calcium to phosphorus ratio is 2:1, which is the optimal ratio for bone mineralization. Breast milk has low sodium, so no hypernatremia. Breast milk has bioavailability for iron and vitamin D in spite of the low concentration. Breast milk is rich in water, no dehydration. And lastly, the dynamic nature of breast milk and the variability of composition according to different circumstances as gestational age, postnatal age, seasonal variation, and day-to-day variation, and even variation in the same field. So, breast milk prevents infection and malnutrition disorders, which are the major health problems in age of infancy. Breastfeeding benefits to the mother. The lactating mother also gains benefits from breastfeeding. Thus, lactating mothers are less liable to cancer like breast cancer and ovarian cancer, less liable to postpartum hemorrhage, and breastfeeding causes rapid involution of the uterus, that is to say, rapid restoration of the normal size and site of the uterus. Breastfeeding has a contraceptive adjuncts, but alone can't be used as a method of contraception. And lastly, breastfeeding establishes a bond between the mother and the infant, which is very important factor for emotional development of the infant. Steps to successful breastfeeding. From the previous discussion, it is evident that steps to successful breastfeeding. From the previous discussion, it is evident that breast milk provides many health benefits to the infant, especially promotion of growth and development and protection against infection. It also provides the mother with many health benefits. Achievement of successful breastfeeding in the community necessitates implementation of the following steps. Number one, inform all pregnant women about the benefits and management of breastfeeding. Help and encourage the mother to initiate breastfeeding as early as possible after delivery, especially in the first hour after delivery, according to the condition of the mother. Number three, show the mother the proper technique of breastfeeding. Number four, exclusive breastfeeding during the first 4 to 6 months of life. That is, say nothing is given by mouth, food or drink, except milk during this age. Practice roaming in, which means leave the infant beside his mother in the same room. Number six, encourage feeding on demand according to the desire of the infant, not according to our desire. Number seven, give no artificial teeth. Technique of breastfeeding. Mothers should know how to perform proper technique of breastfeeding to avoid complications and ensure successful breastfeeding. Proper technique of breastfeeding includes the following steps. Number one, sitting. Mother should sit in a comfortable position, supporting her back. Number two, positioning. The mother holds the baby with one arm close to and facing the breast. The head of the infant is in the crook of her arm. This is the cradle or cross chest method, which is the most familiar method. Other positions can be used. Number three, attachment or latch on. The mother opened the mouth of the infant by touching the upper lip with the nipple or finger. The baby opens his mouth and he is ready for feeding. This is called rooting reflex. The mother helps the infant to grasp a large mouthful of breast, including the areola. Attachment or good latch on is considered the most important factor for successful breastfeeding. Bad attachment means failure of breastfeeding. Suckling. The infant presses the nipple and areola, between tongue and hard palate, initiating the let down reflex, and swallows the expressed milk. The mother hears the sound of swallowing. Duration of nursing it is variable, but on the average 10 to 15 minutes. Prolonged duration of feeding indicates poor milk supply or poor suckling. The mother should nurse the baby from both sides. When the infant finishes feeding, he may release the nipple, or the mother gets the nipple out by her finger. Burping. Gentle tapping of the back of the infant to expel or swallow with air. Then the mother wipes the corners of the mouth and places the baby in the bed. Attaching the baby for effective suckling. Good attachment is the most important factor for achieving successful breastfeeding. On the other hand, bad attachment is the main cause of early problems and failure of breastfeeding. These figures show the comparison between good attachment and bad attachment. The upper row figures show good attachment. Signs of good attachment as shown in the second figure of the upper row. Most of the areola is inside the mouth of the infant. The lower lip is curled outwards. The chin of the infant is touching the breast of the mother. The result of good attachment is proper suckling and complete emptying of the breast. In the lower row, the second figure shows bad attachment. Most of the areola is outside the mouth of the baby. The chin of the baby is not touching the breast, and there is no curled lips. Poor suckling means due to bad attachments means incomplete emptying of the breast and may lead to failure of breastfeeding. Attachment of suckling at the breast. The present figure illustrates the mechanism of suckling. With good attachment, the infant presses the nipple and areola between the tongue and hard palate. A wave of contraction starts at the tip of the tongue and moves backwards as shown by the head of the arrow, expressing milk towards the pharynx to be swallowed. Difficulties of breastfeeding. Some problems or difficulties which may occur during breastfeeding needs rapid and proper management to avoid complications and ensure successful breastfeeding. These difficulties may be related to the mother or related to the infant. Difficulties related to the mother include the following. 1. Anomalies of the nipple. Small nipple, flat nipple, retracted nipple, and inverted nipple are the most common anomalies. How to manage? With good attachment, flat nipple and small nipple and retracted nipple are not obstacle against successful breastfeeding. However, inverted nipple may need extra help for good attachment, and the mother may need suction device, and as a last result, it may use an ultra-thin silicone nipple shield. The second problem is sore nipple and fissured nipple. This condition is severely painful condition, and the cause is the bad attachment. The infant presses the nipple and suckles the nipple and induce injuries to the nipple. How to manage this case? Good attachment and good attachment is the treatment of sore nipple, and the use of antibiotics for infection, antibiotics for fever, and analgesics for alleviating pain. The third problem is milk engorgement. In the 3rd to 5th day after delivery, there is an increase in milk secretion, and the incomplete emptying of the breast causes retention of the milk in the breast, and the breast is full with milk. The breast becomes enlarged, tender, hot, and the skin is stretched. Again, it is a painful condition. How to manage? Immediate emptying of the breast is mandatory by the use of manual expression or by a pump, and the expressed milk is given to the neonate, and then instruct the mother about the proper attachment or good latch-on. The fourth problem is mastitis and breast abscess. Mastitis is a generalized inflammation of the breast the breast becomes enlarged, hot, and tender. How to manage? Give antibiotics, antipyretics, and analgesics, and the mother continues breastfeeding. Breast abscess is a localized infection of the breast. How to manage? Surgical drainage of pus, give antipyretics and analgesics, and the mother stops breastfeeding from the affected side and nurses the baby from the healthy side. When the mother recovers, she resumes again breastfeeding from the recovered side. What about the problems related to the infant? Infant who refuses feeding, you should search for a cause like oral infection, like moniliasis, ear infection, nasal obstruction, colic, and constipation are among the causes which interfere with proper breastfeeding. Also, congenital anomalies like hair lip, cleft palate, and prognathism may interfere with proper breastfeeding. This may be managed by good positioning. The mother nurses the baby in the erect position, or by using a special device, or expression of milk and give it to the infant as a last resort. Assessment of adequacy of breastfeeding. Assessment of adequacy of breastfeeding is done by history taking and clinical examination. What are the manifestations of adequate breastfeeding? Number one, the baby gets satisfied, calm, and sleeps after feeding. Number two, proper gaining of weight. Number three, urination. The infant passes 6 to 8 urine per 24 hours or 6 to 8 wet diaper. Then what are the manifestations of inadequate breastfeeding? The baby is always crying, not satisfied after feeding, and sleeplessness. Failure of gaining weight or loss of weight. Number three, the baby passes urine less than 6 times per day and passes small amount of greenish mucoid stool. We call it starvation diarrhea. Then what are the manifestations of overfeeding? Frequent breastfeeding and overfeeding is characterized by crying due to flatulence and abdominal distension, frequent urination and defecation leading to sore buttocks, and excessive gain of weight. How to manage these conditions? Adequate breastfeeding reassures the parents. In adequate breastfeeding, you are going to use factors which increases milk production, as mentioned before. And if these factors fail to increase milk production, you are going to give complementary feeding. What about the manifestation of overfeeding? How to manage? To prolong the duration between feeds. Contraindications of breastfeeding. Contraindication of breastfeeding may be absolute contraindications or temporary contraindications. Absolute contraindications include conditions which cause serious complication to the infant or his mother. Absolute contraindications related to the mother include insanity, uncontrolled epileptic seizures, medication like anti-neoplastic drugs, radioactive substances, or radiotherapy. Maternal HIV is an absolute contraindication provided that there is another source of milk available, affordable, and sustainable. About the absolute contraindications related to the infant, the most important condition is inborn errors of metabolism as phenylketonuria, galactosemia, and lactase deficiency. In these conditions, the infant is in need of a special formula. Temporary contraindications includes urgent surgical interference to the mother or urgent course of treatment which is hazardous to the infant, and maternal pulmonary tuberculosis, maternal syphilis, and maternal brucellosis till initiation of treatment. Thank you.